So there's a different kind of the breast cancer we can see, but there's we have to know about what's the breast actually. So there is some glands and the tissues we can see. So we have to know about the structure of the breast. So in the breast we can see some glands and tissues. So we have to call lobules and ducts. So these lobules, 12 to 15 lobules in the one breast, we can find it, and then each lobule they have some, the one lobule they have some few glands inside. So these glands, if they have some structure, DNA cell abnormalities, so this is called dense cell structure. So if the dense tissues happen sometimes, like the irregular of the DNA structures or cell cycle, so this is called cellular DNA dysfunction in the breast. So this is the main issues happen in the breast. So there is four kind of the there is some we can see here the breast. This is the right side of the breast. So there is, we divide into the four quadrant, and then the middle area is we call the areola, and then outer is the nipple. So this is the right side of the breast. If you see, this is the upper outer quadrant. This is the most common area is affecting the breast cancers. Okay, so this is the mostly 50% of the breast cancer is occurring in the right side of the breast in the upper outer quadrant. And other structures is like the left outer quadrant is the 15%, and then right lower quadrant is in the 11%, and the left lower right quadrant is 11%, and left lower quadrant is the 6%. So in Pakistan, so we have in our country like in 1 year, 83,000 people are diagnosed with the cancer, different kind of the cancers. But the over 40,000 cancer in Pakistan, the women are dying because of the breast cancer, and this is an alarming sign in our country. So every 1 in 9 women they are affected with the breast cancer in Asian countries, and other countries in 1 in 8 women. Still after the awareness in all over the world, they have still there's the most chances of the breast cancer is most common in the females. As I said, the 1 in 9 women are most common in the Asian women, but for the male factors, like male, they have only the 1 in 1,000 affecting in the breast. So this is very rare and not commonly like other cancer in the male. So in the male structures, if they have some finding, like they had the lump and the nipple behind the nipple, and they feel the swelling behind the nipple. So that, and they sometimes they have pain, and then sometimes they don't have pain, the painless symptoms. So with this situation, males they can consult with the general surgeon or the breast surgeons in their field, but in the area. But the females is most commonly area. As I told you, this is the upper outer quadrant. Sometimes what structures we feel, what symptoms we have to feel in this area or all over the breast. First, I have to explain you about the examine how to the female they can examine their self. This is a very easy way to examine the females, even in after the 30 years of the age or with the 40 years. Okay, so the most common the factor of the age is like the 50 and above. Okay, but with the 40 years you have to be examine yourself regularly every month. Okay, so the most common, like we have to see here some structure I have to show you in the camera. So this is a very easy way to explain you how to you're going to do the examine yourself with the breast. Like you have to sleep on your bed, and then you have to put on the right hand on your left side and the left hand on the right breast. So you have to go like a zigzag outer side of the upper side of the line, and you have to go down, and then you have to go back up. So you have to make like you have to feel your breast. If there's any lump or any swelling in your breast area, so you have to go consult with your doctor. Okay. And the other way, when you feel the axillary, like the side of the breast or shape of the breast. So when you have to straight in the position, standing in the position, and then you have to put your both arms in the chest and in the hip area, and then you have to see the size. If there is any difference in between both breast, that means you have to be care about this. Sometimes this breast size and then the shape of the breast is very important to know, because sometimes the shape is different, like the one breast is big size and one breast is small size, or the structure like different, like you have to see the breast different, like the irregular wall of the breast form. Okay, And then other, you have to go with the examination. This is very important point. So you have to go with the axillary edge area. Okay. So this axillary area, you have to go with the right side and the left axilla and the right left hand and the right axilla. You have to examine yourself. If you feel some glands, lymph nodes, normally when you examine yourself, so this is the alarming indication. You have to go with your consult with your surgeon. Okay, so this is the main, an easy way of to examine how to examine yourself. Like you have to go in front of the mirror, and then you have to feel this that points I tell you. You have to go with the breast, examine yourself, or you can do like the breast. You have to put your hand up and then circular area in the right side and the left side. So this is the easy way to examine yourself in any area. If you feel sometimes like the lump or the swelling, even small tiny swelling, you have to go for the screening test. The color of the breast we have to compare with both breast. So if there is changing in the color like a reddish color or pitting like the dots in the skin, and then the yellow color of the skin of the outside of the breast, the nipple, and then the most common is sometimes like you have to go for the discharge from the nipple. So there is many different kind of the discharge from the nipples can happen, like bloody discharge is if you have when you examine yourself. So you have to go with the when you press the nipple, so you will find some the color discharge like bloody discharge or brownish discharge or yellowish discharge or greenish discharge we saw with the many patients here. So this is the different symptoms they have with the breast. Other symptoms, if you see some patients, they feel the pain with the lump or pain with the swelling, the one feel inside the breast. This is also not good. Once they feel the swelling pain in all over the breast or in the axillary region, or if you see the breast above the breast, we have to one bone we call clavicle. So this bone, I mean the like this area of the breast, upper outer quadrant, supraclavicular, we can say. This supraclavicular, there are some nodes we can feel. Some patients they feel the pain going to the upper arm. So this is also the alarming indications of the patients. Okay, so this is the most common, and the nipple shape is very important. Some patients they have like females, they feel the nipple cracking or nipple going inside. The one nipple is normal outside and one nipple is going inside. So this is also not good. So this is we can say something like this structures. If you feel it, you can see now clear.
Yes.
Yeah.
Yes,
So
ma'am.
this is the nipple. Yeah. This you see the nipple is not a normal. It's just a line, or you can say dimple inside, or you can say it's retracting inside the nipple. So this is also not normal. The breast sign. Okay. And then some breast you can see the skin. It is very common if some patient they have the color changing like this, the black area after the nipple or the areola side, or there is a dots. You can see the dots. So this is a dimpling area on all over the breast. This is very common in the breast cancer. We can see some changings of the breast. Okay. So what's the risk factors? The most common I said is age. Age factor is most common about the 50 years of the age. But the screening in our country, we have to advise with the giving the awareness of the females. You have to go up at the 40 year of the age, because in the family history is very important. If there is a very close relative like mother, father, sisters, or aunties, or in the other family history they have like breast cancer, so they have, or ovarian cancer also, so they have to go for the screening test. The bad thing in our country, I mean, sorry to say, because the screening is very expensive actually. So all the lower class or the middle class, they cannot afford this screening test. But how to prevent in the early stage, they have to go to the examine their self. This is very important. After 30 years, I will believe every woman they have to go to examine their self to the breast, and then if they feel this they're changing, they have more good chances to be to aware these things and prevent the symptoms more worst. So other factors is, as I said, the family history, and then family history with this all the family we can see in the male factors, like other type of cancers. So the female, they have to go like daughter or son, they have to go for the early screening with this. If the mother, they have already the breast cancer or ovarian cancer, so the daughter, she have to go with this early stage of the screening test. Increase the other is the most common chances with the early menarche or late menopause. Early menarche means that some girls, they have like the periods or menses are starting before the age, like, you know, some girls, they're starting the 8 years or 9 years of the age, so they have more chances of the breast cancers even because the hormonal imbalance. And then the late menopause, obviously they have, like we said, 50 is the cut off the numbers, like 50 to 55 years. If they have late menopause, like after 55 years, menopause means the menses stop to coming out. So that means they have after the 55 years. So this is the chances more common for the menopause, for the breast cancer. During the menopause, like after 50 or 55 years, once we giving them some medicines, every woman, they have some symptoms after the menopause. Okay, once they stop the bleeding, stop the period, so they have some symptoms like hot flashes and lethargic and tiredness. So some for gynecologists, so we are giving them some hormonal medications for the 6 months or 1 year. So like this situation, mostly the females postmenopausal, with this hormonal treatment we call HRT, hormone replacement therapy. So this is the hormone replacement therapy. So this hormone replacement therapy, they have most chances. If they are taking like at least 1 year, then it's okay. At least 1 year, they can take. There's no not more than chances. Only the like 10 to 15% chances they get breast cancers. But if they're taking more than 1 year, like 2 years, 3 years, so they have more chances to get the breast cancer. So we ask the patients to, you have to change this medication from hormonal to the non-hormonal medications to prevent your symptoms. So at least we have to prevent the early diagnosis of the breast cancer. Previous cancer, like the patient, if especially for the young girls, if they have like some symptoms, most common the fibroadenoma is the lump, and this is the benign lump in the young girls. This is not cancer, so we have to say if they have lump like 1 centimeter or more than 1 centimeter or 2 centimeter, so when we have to advise them after the ultrasound findings of the breast. So they have to find like they have some small lump and this is benign condition in the ultrasound. So we have to advise them to remove this lump. After the repeating, there's a chances for this lump, if they have some very rarely happen this girls in the early age to get the cancer, but this benign symptoms, so we have to ask them to go repeat it if they have symptoms like same lump if they appearing, so they can go again for the they have chances for the breast cancer in the after the 40 years of the age. If some women they have lump and they are ignoring, of course they have become worst symptoms, like as I said, they have bloody discharge and the discoloration of their skin and the shape of the size and all these conditions. For the other symptoms, like we have to say, like, you know, repeated there, as I said, the pain in the breast or the symptoms, different kind of the symptoms, and then they're extending in the bones, they are feeling the bone pain and the chest pain. So that means this is lump is going more worst in the other side areas of the breast. Okay. The infertility, like the woman they married but they cannot get baby. Okay. So they like this women, they have chance also. They have chance also of the breast cancer and ovarian cancer as well. So for them, we have to ask them to go for the early screening test even. So this is the all the symptoms are here when we discuss about the factors. Uh, there is one we call the BRCA1 and BRCA2. This is the genes actually. Everybody have this BRCA1 and BRCA2 genes. So the mothers, this is coming from the mother or father. Whoever have a mother diagnosed with the cancer and the father is diagnosed with the cancer, so this genes is coming in the from the parents to the children. Okay. So if they already diagnosed with the parents, so this BRCA1, BRCA genes 2, and we have to ask the patients if you have family history, so they have to go in early stage, like 30 years, so they can go this genes test. If they have positive, so they have to start with the screening test annually, and then they have to go like, you know, with the precaution they have to take in the early stage. Okay. So, for example, in the male factors, the male, they have the same, like BRCA2 is more dangerous for them. So if they have BRCA1 is not is too much. But if some patient, if they have some children, they expect with the cancer. So if the one BRCA is affected, so the other BRCA will be helping to save the cancer cells. Okay. Okay. The thing is, as I said, smoking also is very dangerous for the females. Even if there's someone is very chain smokers like this, though they have more common chances for the breast cancer. Obviously, the male, they have other cancers like mouth cancer and lung cancers. But with the breast cancer in the male, yes, they have also the chances to the breast cancer with the smoking. Others, alcohol, that someone is drinking too much alcohol, so they have more chances. Mostly the females, like, the American or ethnic age, like we have to go with the white women, like European or American, they have more chances for the breast cancer rather than the Asian. But still, as I said, the Asian is more frequent, like 1 in 9 women. So they have also the chance of the breast cancer, obviously. So there's other factors like how to prevent. This is very common and very easy to say. Like normal women, they are sitting at home. If they're not going routinely for the screening test, yes, they have other options, like they have to care with the BMI, like they have to control the weight. If there's obese women or they have fat, like BMI like more than 31 or 35 years kg, so they have more chances about the breast cancer. So they have to control their affecting symptoms with the breast cancer. So like diet is very important. If you're going for the diet like healthy and mid-terrain diet, like normal in our diet, mostly the families, they don't take the salad, okay, the green vegetables, and then the nuts and the broccoli. This all the things is very important to take in our regular diet. So this is the preventing, giving you the awareness, the preventing the cancers cells. Okay. The green vegetable is very important. The healthy diet is very important. If you're going to the unsaturated fatty foods, like now these days everybody, they're going to the shortcut foods, like they're taking the frozen food and then they're going to the eating the burger and then the fast food and all these things. This is all the chances making not only for the breast cancer, but the other things also is very common in the females, the hormonal imbalance and then diet and all these issues. So, as I said, the weight is very important. If you are the female, they have like fatty women, like the BMI is more than 30. So for them, they have to be start the vigorously exercise. Like they have to be start the exercise at least 2 hours per day, or maybe the 20 hours per week. So they have to start the exercise. They have to do the cycling. They have to do the walking. They have to do the jogging, and they have to go for the they have very depend on the stages, because I'm not going to explain about the stages, because there's many stages of the breast cancers and many different type of the breast cancers. So this will be very difficult to understand, but the simple way how the treatment areas of the treatment method of the breast cancer is like the lumpectomy. So once we have got for the breast lump, they start like the swelling, or we can say lump, or the cyst, or some other structures involved with the other breast area, like the other structure of the breast, like not only in the breast inside, but the side, like in the lungs or the bones or the other area, the lymph nodes. So like this situation, so we have to advise them to the surgeons, they have to advise the lumpectomy, they have to remove the lump, or the mastectomy. Okay. This all is depend on the stages of the breast cancer. Sometimes they just advise them to just remove the lump, or they remove the swelling, they feel the hard things. So they have to remove that one and they leave the breast there. And sometimes they have to depend on the stages, so they have to remove the affected breast only. Okay. So they call the mastectomy. And then some with the mastectomy, they have to remove with the mastectomy like the breast, and then when I show you the axillary region, okay, so there is some lymph nodes they feel, so they have to remove the lymph node as well. So they have the several type of the lymph node, like axillary lymph node, supraclavicular lymph nodes, so they have to remove accordingly in the stages. Chemotherapy is the one also the option for the treatment. So the most common, they treat with the center, like the anti cancer drugs with the chemotherapy they are giving. And then the other options, the radiation laser therapy is also the options for the to give them the radiation therapy for them. So you have to go like with the stages level. And the last is the immunotherapy. They have to give the immunotherapy as well. So some kind of the medication they are giving, like I said, the hormonal medications. They have only the medicines they are giving, not only the chemotherapy or radiotherapy. So for this medication they are giving for the time beings, like 8 months or 1 year or the 2 years. It's depending on the situation until the subside the tissue or the breast. Okay, this is all over